Welcome everybody to Rebuilding Me 101, our Facebook group and our YouTube channel. Our discussion tonight has to do with salt. Sometimes it's been demonized. It's been said to be such a bad thing. And other times, especially on keto, we are encouraged to make sure we have enough salt. So salt is a very important subject because too much of it, it can kill us. It can sort of start a whole chain of events that could become a systemic problem and ultimately end up in death. If we have too little of it, we can also experience major problems. So what we're going to talk about is the balance of it and the importance of it, what it is, how do we do it on keto, and what are some of the dangers? How do we find the balance? And specifically, one of the biggest concerns when we deal with salt, everybody's concern is because of blood pressure. We have people that are members here right now that I'm looking at, and some of you have had to adjust your blood pressure medicine because of coming on to the keto diet. Because the keto diet will naturally lower the blood pressure. And if you continue to take these water pills, as they're sometimes called, these diuretics or these blood pressure meds, then you can actually have a dangerous spot where your blood pressure goes real low. So it's an important subject that we consider here in our Rebuilding Me 101. Let's ask this question, and maybe if this were a multiple choice, see how many of you would get it right. Is salt a vitamin? Is it a mineral? Is it an electrolyte? Everybody know? I know you're all muted. But if you said it's a vitamin, I'm sorry to say you're wrong. But it is the other two. It is an electrolyte, and it is most certainly a mineral. When we use the term salt, what we probably definitively should be saying is sodium. Salt itself is a mineral, and sodium is a component of the salt. But many times we use the word interchangeably because there's so much sodium in the salt, and the active ingredient we're looking for is the sodium. The sodium is the electrolyte. What is an electrolyte? Electrolytes are part of your system's way to regulate the fluid and, believe it or not, the electricity in your body. We don't often realize that our heart rhythms, our twitches in the muscles, they are all biochemical responses that convert biology into mechanical energy. I'm not going to go too crazy with this, but basically these electrolytes, these minerals can create, they have ions in them or electrical charges that can cause the muscles to twitch, to expand. When I go like this and I pull up a weight, that is an electrical message from the neuron in my brain that goes and activates the sodium, the potassium, the sleeve that the muscles are in, the tubes that they're encased in. They all need electrolytes to go to contract and expand, including our heart and other vital organs, our whole diastolic system that moves food through our intestines, even our birth canal. If we were giving birth, if we were other processes, the muscles contract and expand, and they move things along whatever mechanism that they're used that has electrical charges. So it is vital that we keep the electrical current proper so that our brain works, our heart works, other organs, and we're going to stop there because we could go very far into it. As we age, and I take exception with this term, as we age, because I'm reading right now from a paragraph in a medical book from a doctor, and he says the main concern about our dietary salt is its relationship to high blood pressure. Here's the we age part. Unfortunately, as we age, our kidneys' eagerness to save us from low blood pressure sometimes works against us. I'll give you the short version of that. There's a misread in our blood pressure and our salt, and in an effort to increase the blood pressure so it doesn't drop, your kidneys actually hold on to salt and that raises your blood pressure because salt retains fluid. That's why if you're swelling up or you have edema or they give you this water pill, they're trying to get you to relieve water. Why does relieving water affect your blood pressure? If you get water out of the system, especially excess water, imagine your blood arteries and your vessels as giant plumbing. The volume of water creates the pressure. If you can get if the pressure gets too high and it endangers the arteries, it endangers the heart, they want to lower the volume going through the tube. And so they get rid of some of the water, which increases what fills up the tubes, the arteries, the blood vessels, and so forth. And then, of course, you secrete that through your urine, and then that can lower the pressure. So because salt retains the water, they give you a diuretic. In other words, a pill that neutralizes the salt and allows you to get rid of water. Now, here's the problem with that. The same journal that recommends that as the most common approach to lowering blood pressure also says this, and I'm going to quote this directly, and this is from Dr. Robert Thompson. Will avoiding salt do you any good if you don't already have high blood pressure? Listen to this. There is little evidence that lowering your salt intake below average will prevent you from developing high blood pressure. In fact, some studies suggest that a lower than average salt intake is actually worse than an average salt intake. So lower salt can be worse. Why? Remember the kidneys, they're monitoring your blood. They think you're low, they start holding on to salt. So if you have a misread, your kidneys are working against you. This is his advice after saying that you may want to reduce your salt, basically says it might not do you any good. That's a little bit of a conundrum, right? Can you see why there's some confusion? Now, what's interesting is we continue on, he actually answers the question. I was talking to Dad earlier, and I'm not a doctor. I'm not some special brainiac, but see if you can find the very answer in his own words that he says eludes us as far as handling blood pressure. Listen to this. Salt is a minor contributor to most people's salt intake. The main source, remember we're talking about salt, is processed foods. In fact, the largest source of salt in the American diet is bread. To make a dent in your salt intake, you'd have to avoid a lot of foods. And then he goes on to say, we know that's basically impossible, so you're kind of on your own, talk to your doctor. Now, let's just segue a little bit and talk about a carbohydrate-based diet. We know, and this is just me, a layman talking here, that carbohydrate diet is high in glucose. Glucose forces 3 grams of water molecules to stay in your system just to process 1 gram of the carbohydrate. So here's a question from somebody who's not a rocket scientist. If we don't have a glucose-based, carbohydrate-based diet, we would lower our blood volume by 3 grams per unit. So every molecule that's running through the bloodstream, it doesn't have to bear hug 3 other molecules of water and force their way into every cell that they go into and then create such expansion that it can actually cause edema. See, that's what happens on a glucose-based diet. So what if the doctor just said, hey, you know, if you converted from a glucose-based diet to a ketone diet, you would lose a lot of volume and you wouldn't have to have meds that forces now to prescribe separate meds for your heart because your heart needs salt to help regulate it. So do you see the problem? It is almost laughable. They're giving you meds to lower your salt, to lower your blood pressure, but they don't consider the alternative of changing, as he says here, the Western American diet as the biggest contributor to high blood pressure, not the salt on your table. Incidentally, we of course recommend sea salt or even more minerals as the Himalayan salt. Do not use table salt. Table salt has other fillers and anti-clogging ingredients that are bad for you. The only advantage to the table salt is they do put iodine, but we recommend iodine supplements or eat kelp and some other things. So let's review. We must have salt. On your keto diet, we highly recommend you would get that from your foods such as feta cheese, other foods that we have that have salts, including vegetables that are not carbohydrate dense. And so the volume of your blood will go down. So if you're on high blood pressure meds, you really want to consult your doctor and tell them that you're doing a keto diet, because the volume of your blood will decrease within your veins and your arteries because of the nature of your food. Why that escapes medical professionals, I have no idea. The very food that they admit, the Western standard American diet, is the biggest contributor because of its processed food to salt, but they never consider that as an alternative rather than meds.